if detected, and then how do we further test these tumors, and how do we go ahead and diagnose and prove that it is a lung malignancy? Now, tests are by way of tissue diagnosis. So what we do is we try to take a small sample of that particular lung lesion to see what type of a lesion it is. So as I mentioned, all these lung cancers, they are not one subset. There are different subsets, and the biology of these tumors vary according to the type of lung cancer. So what we test is we look for a few targets. As I mentioned earlier, especially in non-smokers, there are a few targetable mutations. So we especially look for these targetable mutations. So that is done by way of a next generation sequencing, which is a high proof, thorough proof sequencing, where they look at lots of mutations which can be targetable. Apart from that, we have newer options of immunotherapy, which I'll explain to you eventually. So we also look for few markers where immunotherapy could be of use in these patients. So once we get a diagnostic proof of lung malignancy, the next would be to do a staging. Staging, I mean, we look at the extent of the lung lesion and to see whether it is localized or has it spread to any other organ per se. So what we do is we do a PET scan here routinely. So by PET scan, we also look at the lesions which get highlighted, the activity of the lesion, and also the extent of disease. So how do we treat lung cancers? Just a brief overview. So we treat lung cancers based on the stage. So early stages of lung cancers, we see if it is resectable. If a surgery can be done, they do the surgery, they take out the lesion. Second is if it is locally advanced and if it can be incorporated into radiation, then we have high-end radiation machines now which are very conformal, which do not cause a lot of toxicity. So it can be dealt with radiation along with small doses of chemo. So it can be done concurrently along with chemotherapy and radiation, which we do as a routine here. So it is very well tolerated without any harmful side effects. And if the tumors have metastasized or they are slightly advanced, then we have options of chemotherapy, and then we also have options of immunotherapy and targeted therapy. We routinely incorporate immunotherapy and targeted therapy now, which is put in a basket as personalized medicine. So that is something which we do routinely. And the advantage of doing this is, one is it is very much tolerable. The side effect profile is very good. So most of the patients, even very elderly patients, they do tolerate this treatment well. And the prognosis is much better. The predictive value also is very good. So these medicines, by incorporating them into conventional treatment, we tend to extend the progression of the disease by a very long period of time. And again, quality of life is also very well maintained when we use targeted therapy or immunotherapy.